Hi, I'm Dr. Douglas Dieterich. I'm the director of the Institute for Liver Medicine and the Mount Sinai Health System, professor of medicine at the Icahn School of Medicine and the Division of Liver Diseases. Depends on which one you're talking about. It's important to note that actually this month is May, the National Hepatitis Awareness Month. And we have a new type of hepatitis that you might have seen in the news, the adenovirus hepatitis in children, which seems to have started in the UK, and 9 children in Alabama had it, and a few others are being reported. So that's a whole different virus from what we normally consider to be hepatitis viruses, which are A, B, C, D, and E. Hepatitis A is spread usually by food. It's a fecal oral method. So it never becomes chronic. That's the good news. And it rarely is fatal, although it can be at times, particularly in the elderly or in people who are immunosuppressed. Hepatitis B, that's the big one, B for big one. It's probably infected around 1 billion people worldwide. About 1 million people a year globally die from hepatitis B, and mostly from liver cancer caused by hepatitis B. The vast majority are in Africa and Asia, although it's a significant issue in the US, mostly because of many people have emigrated. The good news about hepatitis B is we can control it. We have 3 really good drugs, entecavir, tenofovir, and tenofovir alafenamide, but we can't cure it yet. We're working on that with multiple combinations of experimental drugs. But even better news is we can prevent it with a vaccine. Everyone who was vaccinated, who was born actually after 1991, should have been vaccinated, although the American College of Immunization Practices now actually recommends universal vaccination for hepatitis B. And therefore actually universal screening for hepatitis B. So we have actually instituted that using our electronic health record at Mount Sinai. So we're going around to all the primary care clinics and trying to get everyone screened for hepatitis B. If they're positive, referred to liver so we can treat them. And then if they're negative, they should get vaccinated. We have a really good new vaccine, 2 shots, 95% effectiveness, 1 month apart. It's actually a great thing. Now, hepatitis C for a long time was a real problem. It affects probably 5 or 6 million people in this country, and the numbers actually, unfortunately, have been going up in the last 2 years of COVID because of increased IV drug use, not down, even though we've treated over 1 million people and cured them. That's the big thing. So in the last 5 years, we have very effective treatments, oral medication, 1 pill a day for 12 weeks, or 2 pills a day, or 3 pills a day for 8 weeks, can cure 99% of people with hepatitis C, and that's truly cured. It's gone out of the body forever. Well, hopefully forever, although you can get it again. People can get reinfected with hepatitis C. Hepatitis D is for Delta virus, is very interesting. It actually cannot exist without hepatitis B. It's a very tiny virus, and it uses hepatitis B as its outer coat. And we're lucky that a new drug is on the way for hepatitis D or Delta. It should be approved in the US in October, and it's been approved in Europe for now about 2 years. So it seems to be safe and effective. The bad news about hepatitis D is if you don't treat it, it results in very rapid progression to cirrhosis and liver cancer in patients who have hepatitis B, of course. And then finally, at the end of our alphabet is E. Hepatitis E is very similar to hepatitis A, never becomes chronic, or very rarely, except for in immunosuppressed patients. And it's also fecally orally spread. You can get it from food. One of my patients got it from pork tartare. Actually, it's a very common virus in swine, And actually, so pig farmers are very commonly infected with hepatitis E. And of course, if you're eating raw pork, that's another risk for hepatitis E. There's really not a very good treatment for it, but it's similar to hepatitis A in that it almost always resolves on its own and is almost never deadly. Treating hepatitis C is easy. Like I said, 1 pill once a day for 12 weeks, or 3 pills once a day for 8 weeks. Honestly, the side effects are almost zero. We get a few complaints of headaches the first week with both medications. And honestly, that's really about it. It's almost zero. For hepatitis B, it's also 1 pill a day, virtually no side effects there. And we'll watch people with hepatitis B every 3 months. For hepatitis C, we might see them 1 month after starting treatment, at the end of treatment, at the end of, say, 3 months. And then 3 months after stopping is called the SVR, the sustained virologic response. When we do that blood test and the virus is negative, at that point, we declare them cured of their hepatitis C. The only people that will require long-term follow-up are the ones that have significant fibrosis or liver damage, scarring. So we need to keep seeing them to screen them for liver cancer about every 6 months. Hepatitis C is eminently curable. Hepatitis A and E usually cure themselves on their own. We clear those easily. So hepatitis B is not curable yet, nor is delta hepatitis, but we're working on it. Lots of people, lots of shots on goal there. A lot of people doing a lot of clinical trials. We have a really big support system, actually. We have a whole group of navigators and coordinators and a social worker that can help guide them through therapy, help them to get to their appointments, make sure they get their medications delivered on time. It's been very successful. Actually, we're very happy with this program. And they've also been actually actively engaged in getting all the positive hepatitis tests from the laboratory and seeking out those patients to make sure that they're getting treated. So we have a lot of support for patients with hepatitis. Yes, it's very important to be treated by experts. We have at the Institute for Liver Medicine, we have 7 hepatologists, 2 NPs, and 1 PA, all extremely experienced in all forms of hepatitis. So if it's easy to treat, that's not a problem. You can do that at your primary care doc. But if it's at all complicated, if there's significant liver disease, you really need to be at a advanced center like the Institute for Liver Medicine, so that you have all the resources available to look for liver cancer, to treat complications of liver disease, and to watch out for further issues that can complicate your liver. So we have a fantastic group of physicians and mid-level providers. And actually, we're backed up by a wonderful research laboratory as well that can provide us with lots of interesting data.